Hi, I'm Dr. Christopher Bates, orthopedic hand surgeon and co-founder of Betterway Medical Group. We have done over 4,000 WALANT-style in-office surgeries, and now we're helping other private practice hand surgeons get paid more for doing these cases in their office. Today, we're going to talk about trigger thumb, some tips and tricks on how to make this go really smoothly. This is one of my favorite cases to do in the office, watching that patient move that thumb, and when they see that it doesn't catch and trigger, they just light up. So enjoy. Let's get right into it.
So what we're going to do first is put our initials on you. We got to do that in case the old government's watching, all right? So you agree we're doing the left side and a trigger thumb. Is that correct?
Yes.
Okay, so trigger thumb incision goes right there, okay? I'll go right in that crease. Beautiful. Okay, let it down a little bit. Now up here I'm going to put my initials. Now initials are just in case the old government's watching, okay? All right, so now we'll get you all cleaned up. This is a little alcohol pad. We're just going to clean the skin there. Then what we're going to do is we're going to start our injection. Now that's the toughest part of the procedure today. It's where you feel the most discomfort because you have a poke and a burn, okay? But we do a lot of things with that poke and burn to make it much more tolerable. Now what we're going to do is we're going to have you straighten your fingers out, lift that thumb straight up like that, and you're going to hold it up like you're trying to hitchhike, okay? I'm going to get positioned like this, and you're going to push into me, okay? You ready as you'll ever be?
Yep.
I know it ain't fun, but this is the best part, okay? So push that thumb up into my hand. We're gonna go in, push it up into my hand. There you go, good. Okay, big stick on 3, ready? 1, 2, 3. Yep, I know, that's the tough part. Now we start.
4, 5, 6.
Now we start giving the medicine, and that medicine's gonna go in slowly and slowly because I don't want it to burn like the dickens, okay? It usually does, but we'll make it a little bit easier, okay? Good, so we just slowly give that medicine, okay? And we're gonna fill up this whole space with that numbing. How's it feeling? How is it feeling?
Can't really feel it now.
Good, good. That's because I'm going slow. We're giving the numbing medicine super slowly. That way it only burns for about 30 seconds. And then usually after that you get a little bit of a burn, but more pressure than anything, okay? Won't be terrible. And then it'll start filling up with pressure sensation. And that pressure is actually a great sign. That pressure means that the numbing medicine has already started to take effect and that it's actually starting to numb the nerves with pressure, which is a great thing. We give you a ton of numbing medicine because we don't want you to feel any pain when you're back there, okay?
How many days will it be before I actually really can start mowing and everything again?
As soon as you're ready, but realistically, I don't want you to sweat a bunch when you still have the stitches in, you know? So that's about 10 days or so, okay? So it's not terrible, but it is a little bit of time. Good. Oh yeah, nice and puffy from here to here. Love that, okay? Give about 8 milliliters.
Really up now.
Yep,
That's what it looked like.
After doing about 2,000 of these procedures in the office, here are the key takeaways. Use a calm voice. Explain every step in the procedure as you're doing it. I have found this incredibly helpful and really puts the patient at ease. When you tell a patient what they're going to feel before they feel it, it really instills confidence in you as the surgeon. And they say, man, the doc knew exactly what I was going to feel before I felt it. He told me, he warned me, I was prepared, and it goes really smoothly. The second most important thing is to always stabilize. Make sure you've got both hands on the needle and the thumb, and especially in the beginning when you're doing that first 1 to 2 milliliters, stay very still. Don't move the tip in the needle. Inject slowly. The next part, stay superficial to the sheath. I can't emphasize this enough. You don't want that epi to run down the sheath to the distal aspect of the digit. When you stay superficial, I never see a white digit. And so if you're seeing a white digit on all of them and people are complaining about the pain and the pressure going down the finger, you're probably too deep. I found that that's actually kind of difficult to do, especially in really thin hands. So sometimes I'll inject that first 1 milliliter, wait for it to numb, and then redirect to go a little proximal or stay a little bit more superficial once that dermis and epidermis in that area is numb. So next, you're done, right? Go do the procedure. I love watching patients' faces when you show them that they can flex and extend the thumb and it doesn't trigger anymore. It's an awesome procedure to do in the office. If you haven't done it, you really should. If you need help or you found this video helpful and you're a private practice hand surgeon that wants to get paid more for doing cases in the office like this, send us an email, reach out, emails over here to the side, and we'll see how we can help you. That's it for today. Enjoy. Have a great day. Bye.